Dr. Berger, thank you so much.
Hi everybody, how are you? So as Allison so eloquently explained, I am a pediatrician, and I work here in town. I did my pediatric residency at Tampa General Hospital at University of South Florida, and I have now been a practicing pediatrician for 21 years, which is a long time. And so recognizing when this issue kind of came up at the school, and it had been something that, is certainly becoming a big issue in the field of pediatrics as a whole. And so I figured, well, hey, this is a good kind of talk that we can kind of share with a lot of information, because there is a lot of misinformation that's out there, but also both in terms on the pro as well as the negative side of things. And so I really want to go through, and we'll delve into that. Okay, so first of all, so approximately 3 months ago, the FDA declared that youth electronic cigarette use, which is vaping. So traditionally, when a person has smoked a cigarette, it's been something that they light and then they burn. And what the person's typically inhaling is nicotine, in addition to ash and all the other carcinogens and things that are within cigarettes. And so vaping is a concentrated oil with nicotine in it that people inhale in a similar type of inhalation, but they're not burning anything into their body. And so there had been this thought, oh, this is a much safer way of going, but we're going to kind of talk about that more. But it's actually considered an epidemic at this point. Right now, you can see here that in just a year's time, there's been a 58% increase in the use in Florida. 25% of high school students have vaped this year. Okay, that's a large number. But it's still tobacco, okay? It's still nicotine. It's still having a lot of the same effects that smoking a cigarette will have. So what is it? So first and foremost, we want to understand it's a way of inhaling is one of the ways that we get a chemical into our body. Whether it's a pharmaceutical or when people do things recreationally, people smoke cigarettes, this is a delivery system. Okay, and it's an effective delivery system because our lungs are very blood-filled. All of our blood circulates through our lungs every single time it goes through the body. And so it's a very effective way of getting something into the body. Okay, and with vaping, a fine mist is created, and it's delivered through either the nose or the mouth. Okay, now in some health conditions, this is actually a very effective way of giving a person a medication. Okay, and the most common way that people know of inhaling is a person with asthma. Okay, little babies, you can use with a mask type of system such as this in order to breathe in this fine mist to deliver this medication to their lungs. There's also what are called pipettes, which people use. This is somebody being treated by EMS. And then also, everybody's kind of seen asthma puffers, and they've actually shown with spacers, and they put, and as you can see how this girl is puffing the inhaler into this space. It actually floats in there, and then when they breathe it in, it actually gets very effective, and this is actually considered as effective as when a person uses an asthma mask and nebulizer. When a person does a puffer up to their mouth, half of it hits the back of their throat and doesn't even get into their lungs in the first place. But inhaling, when it's done properly, can be a very effective way of delivering medicine. Other ways that we have in medicine been delivering through mists and things into our respiratory tract are the flu mist, which is the flu vaccine that people do instead of the injection. There's a nasal spray version that's available. So anybody who got their flu shot, yes, you could have done it in a nasal spray as well. And even gene therapy, people with cystic fibrosis, they actually can inhale these like little pieces of DNA and actually can reset their disease. So inhaling can be a very helpful thing for people. However, when it comes to nicotine, when we're inhaling it, whether it's done in a smoked way or in a vape way, it still has some significant repercussions. Okay, so one of the really nice things that we had seen with education is that the use of cigarettes themselves has been on a very steady decline in our society, both among youth as well as the adult population as a whole. We don't see many people walking around smoking cigarettes as we used to. We've known for a long time not to do it during pregnancy, and obviously we don't want kids doing it. But really, as a society, we've actually done a pretty good job at reducing, of educating people so that they don't smoke cigarettes. Okay, but now they say approximately 2 out of every 100 middle school students, about 2%, reported back this was last year, that they had smoked cigarettes in the past 30 days. So that went down. Okay, that was really nice. We went from 4% to 2% when it came to cigarette itself smoking. However, almost 8% reported the use of for high school students had actually used it, and that also was a decrease of 15%. So again, these trends came out very nicely because we educated people. Okay, now, these are some of the apparatuses that are used for people who are vaping. And what you'll see for the most part is that these are batteries, different types of batteries. These are cartridges that are typically filled with oil that have different flavorings in it, which have some issues we'll get to, plus the nicotine. Okay, so juices are kind of the term that they're using to fill those cartridges up. Okay, and one of the things that you'll see is that people use these and they'll fill them up and they have different flavorings. And one of the things that I noticed right off of the bat with this picture here, it almost kind of reminds me of walking through the cereal aisle. You know how this is attracting youth. Okay, these aren't just black and white bottles. They actually do things in order, just like with, you know, there's a reason why they put the sugary cereals down on the bottom and they put like the healthier cereals at the top, because kids are down at the bottom range in the supermarket. So they're doing things in order to try and attract youth, okay? And obviously, who wouldn't think that that's kind of interesting? That would grab anybody's attention, okay? Now, this was more of the same of what had happened a few decades ago when they tried to bring cigarettes in to try to subtly, because obviously they couldn't just sell it to kids. Obviously, there was an age group. So what did companies like Camel do? They made it into cartoons. Now, obviously, most adults aren't going to be attracted to a cartoon the way that a kid can be attracted to it. So here, you know, a perfect example. In one place, there's a cool guy riding a motorcycle, hanging out on the beach, you know, hanging out with his friends. And what are they all doing? Every single one of these camels got a cigarette in their mouth, right? That's very subliminal advertising, and maybe not so subliminal if you actually look at what we were being exposed to, and what we're still being exposed to. So this is kind of just a way that they're kind of indoctrinating our youth without coming out and flat out saying it. Okay, so one of the things that we're most concerned about is nicotine, okay? And so what is nicotine, besides the fact that it's the main thing that's in cigarettes? Okay, and it's the addictive ingredient that's found in cigarettes, and that's important. That when people, the reason why it's so difficult for people to stop smoking is because once they've had nicotine in their body, and then it leaves their body, they start to feel bad. And so they have to do it again in order to feel better, or just to not feel bad, right? Kind of sad, and sad that people will do things just to not feel bad, when if they didn't get started in the first place, they wouldn't have this whole situation going on. But then they get hooked. Okay, and that's why it's so hard for people to stop smoking cigarettes, and why it's so important to not get started in the first place. But the issue is that it's the nicotine itself, which is the exact same thing that were in those dropper bottles, is nicotine and different flavors. Okay, so now some medications that we all know about, some of the pain medications, like people have problems with, like you've heard of OxyContin and these pill mills, Valiums, which are medications that people use to calm themselves. Those also are things that people can come dependent on. So we know alcohol as well. We know that there are certain substances out there that once your body's been taking it for a period of time, it's like you need to keep giving it to your body so you don't feel bad. Okay? So again, that's a lot of what the problem is here. Okay? Almost like it doesn't need to take it. Okay? So other drugs as well can have the same type of aspect. Okay. So why is nicotine such a bad thing in the first place? Okay? Well, because of what it can do to your body. Okay, first of all, for some people, they can give them like a burning sensation in their mouth and throat. It can actually cause them to get nauseous. They can have abdominal pain. Some people, if they take enough nicotine, can actually start throwing up. They can start salivating, a lot of spit in their mouth. It can get kind of really gross on them, and the more people can use it. So it can actually make our heart beat a lot faster. It can make our blood pressure go up. It can throw off our blood sugars, and it can make our have clotting issues as well. So these are pretty serious things that nicotine does, and that's true whether it's a person smoking it as a cigarette or if a person is vaping. Okay, it's still the same chemical. That's the problem. Okay, it even causes a decrease of blood flow to our brain. Kind of important to have blood flow into our brain, but that's one of the things that it has. It actually slows the blood flow to the brain. Okay, and they've shown that this is true when nicotine is given in other ways besides a person smoking it. Okay, so these effects happen just because it enters the body, not because it was simply in a cigarette. Okay, and that's an important part, because it's the chemical itself, no matter how it's given. If you put it on a spoon and someone were to swallow it, they would have a similar type of effect. The past couple years, people have been hearing about Juuls. Okay, and what Juuls are, and now this is a company that just started last year. Okay. People weren't talking about Juuls a few years ago, okay? The company didn't even exist, okay? But by a couple months ago, this one company, through their aggressive marketing and through their approaches to kids, 72% of all of the e-cigarettes being sold in the country was from this one company. They weren't even in existence a year ago, and all of a sudden they're taking over 72% of the market. I mean, they must got some good marketing people there. It's not helping our society, but they're making a lot of money and they have good marketing there, and that's part of what the issue is here, okay? And again, part of the issue is that they're selling it as a safe alternative to cigarettes, right? And we just learned it's not, but that's how they're selling it. Again, safer, okay, that's a fair argument that you could make, but safe, not so much. Okay, and again, because kind of as we were showing before, they're doing this to try to attract young people. Okay, now all Juul products do contain nicotine. Okay, so there you may hear, oh well, you know, oh there's just some other oils in there. No, every single Juul does contain nicotine. Some has more than others, but it's all of them have nicotine. Okay, now, and this is kind of again part of this thing of how they're getting the kids hooked. Okay, so they make these very cool colors, very bright to ourselves, fun names like cool cucumber and mango and you know classic menthol and all of these things. These are the different flavors that Juuls come in. Okay, so people don't even realize necessarily that they're putting nicotine into their body because they're doing it because they think it tastes good. Okay, and so that's an issue. Now, these are actually the different things. This is how they advertise it, ripe with a hint of tropical fruit. Sounds like a smoothie, right? You know, but no, it's something that's bad that people are putting into their body. A crisp peppermint with a soothing aftertaste. Sounds like your toothpaste, right? You know, so every single one of these things, cream, like a vanilla cake, silky custard, creme brulee. I mean, it sounds like we're going to a bar mitzvah now, you know? So all of these things are done to hook the kids, okay? And that's obviously a big problem. And so they even sell them in these packs, okay? So what you see here, and so is that this here, these are the actual pods, and inside of them are the oil, okay? And then you stick them in this end, you charge it with a USB, and people walk around with these things, and they really, you know, it's not giving off the smells that people smoke cigarettes, and people don't even realize that they're doing it sometimes, or their parents may not know, or other people, because it's a lot more keeping it kind of local type of thing with it. But that's part of the issue, and so people buy these different flavorings, and oh, let's try the mango one today, let's try the cucumber one today. How fun is that cucumber? Maybe it's healthy for vegetables, you know, who knows. But again, this is what people are seeing out there. Okay. So now, what about, now there are actually some e-cigarettes that do not have nicotine in it. Not the Juuls, but there are products out there. So people then say, oh, great, now we can go ahead and vape and not have to put nicotine in our body and not get hooked on it, which again, better than getting hooked. That's a good thing. However, what they have discovered is this new condition that had never existed before called popcorn lung, okay? And this has nothing to do with how much butter you put on your popcorn. Okay, and what it basically is, it's a scarring of the tiny air sacs that are called the alveoli, if you've learned about that in biology, that are that's where the air gets exchanged into our blood, in the very end of our lungs, okay? And there's causes a permanent scarring in those sacs of our lungs, and it causes a thickening and a narrowing of our airway. Okay, so if you think about it, you know how like McDonald's, how they have like really fat straws you can suck the milkshakes through, but then like some other places have really thin straws? And imagine trying to suck through one of those thin straws. Imagine if that was the only way that you could breathe was through that one of those thin straws. You know, you have to pull a lot in your sucking it in order to get the air into your lungs. Okay, this is a similar type of thing. It causes a narrowing of the airway, so your straw is getting smaller. And so then that's going to cause more problems because you can't get the air in, and then when people exercise, that can be a problem, etc. Okay, so over a decade ago, and the reason why this first started becoming popcorn lung is not because it actually looks like popcorn in your lungs, but they first discovered this problem at a popcorn factory. Okay, and they found that the artificial butter flavoring that they put into like the microwave butter, that actually was in lots in this one room, and then they found that that this inhaling it, and it was like, you know, so it's not just in popcorn, it was found in some caramel flavoring and other things. But it caused this condition, so the scientific word for popcorn lung is this bronchiolitis obliterans. It obliterates your bronchi. It's a terrible sounding thing there. Okay, and as I said, it can cause a serious, irreversible lung disease. Okay, so now, a couple years ago, the American Lung Association realized that this ingredient, which you can see here called diacetyl, which is the ingredient that causes the popcorn lung, they then found that it was the same thing in most of the flavorings that are in e-cigarettes. Okay, so even without the nicotine, people are inhaling this toxic substance and not even being aware of it. Okay, and they don't cough up a lung like when a person smokes a cigarette, so they don't feel immediately bad the way that a person may do when they smoke a cigarette. Okay, they have a taste. Hey, that breathes pretty nice. You have no idea that you're damaging your lungs when this happens. And that's obviously a problem, okay? So now, what other things besides actual damaging of the lungs itself? Well, they've also shown that these same flavorings actually can cause heart problems as well. So it's not just bad enough that it hurts our lungs, it's gonna hurt our heart as well, okay? And what they found that every single vape flavoring, when they tested it, would actually change around our blood vessels, our arteries, and our veins. It caused scarring and damage to those blood vessels, and they actually show that that is actually one of the earlier signs of when people get heart disease. So a person doesn't just get a heart attack, okay? It takes years and years of damage to your heart, and your blood pressure goes up and all of that, that eventually your heart says, you know what, I've had enough of this. And then your heart stops, and that's when a person has a heart attack, okay? That takes years to build up. So even if a person was doing this for a few years, I mean, it takes a lot longer. But again, with these companies that they're getting people hooked, and people are using them for 10, 20, 30, 50 years, that's what causes this problem. So now what they did, and as you can see, a lot of these are similar flavors that we were talking about before with the Juuls. But every single test flavor that they tested caused cell death when they exposed enough of it to the cells, like in a petri dish in the laboratory. Okay, well, that's in a laboratory, okay? How's that going to affect my lungs? You know, I'm not a laboratory rat, I'm not a petri dish. Well, here's what they found. There were a few of the same and the most common flavorings: cinnamon, strawberry, banana, a spicy cooling, even at lower levels cause cell death, and especially for these, and the strawberry had the actual highest amounts, okay? And what they found is that the levels that were for all 9 of those flavors, you probably wouldn't get to that amount for just every occasional vaping. But the low levels for those 5 that are listed there are the same amounts that people are getting when they're vaping. Okay? So now we've discovered, even when there's nothing in terms of a smoke itself, ash itself being put into our body, it damages our heart, damages our lungs, irreversibly. Okay? So that is pretty much what vaping is about. So if anybody has any questions, I would be happy to talk about it.